My name is James Gutz. I live here in Columbia, Missouri. When I was about 17 or 18, I was in my senior year of high school, and I had my first psychotic episode. It put me in the hospital. I got diagnosed with schizoaffective disorder, bipolar type. It's basically a disease similar to schizophrenia. Before then, I had like a working sort of diagnosis of major depressive disorder. And when I had that psychotic episode, my life really changed. Like, before then, to be a little immodest, I was like, not a straight A student, but like a low A student. I was in AP classes. I thought that I was gonna go to college and study linguistics and become a professor and everything would be fantastic. And then I started like regularly going in and out of the hospital, trying different kinds of therapy and different medications just to like manage my day-to-day life. And I realized, oh, life is not going to be simple for me. I realized that I'm currently on a cocktail of medications that works well for me, and I'm starting to go back to school. I'm working about part-time, actually a little less than part-time, and after 2011, 7 years, I'm starting to really get back to knowing what my life is like again. I want to be able to live a normal, healthy life and have it be known by people that I have schizophrenia, or a condition related to schizophrenia, that I have a condition related to schizophrenia, so that people can look at me living my normal, healthy life and say, psychotic illnesses are survivable, and people with them exist outside of the antagonists of horror movies. Allowing insurance companies to deny me insurance coverage for my mental health condition means that I wouldn't be able to afford the medication I need, I wouldn't be able to afford to see the therapist I need, and I wouldn't be able to afford the care I need to live my life to live a normal life. I wouldn't be able to afford the care I need to live a normal life. Having a senator who's fighting to protect and expand access to affordable health care is huge. I'm not the only person in my life who needs affordable health care. I have friends with other disabilities. I have friends with pre-existing conditions. I have family with pre-existing conditions, and we all need access to health care. And as I said, it's depressing to have to fight for your basic rights, and having someone else who's willing to fight for you is heartening. When I was 17, I thought my life was going to go perfectly, and that I was going to be healthy forever, and that I was going to that I knew what my life was going to be like. And suddenly, I didn't know if I was going to kill myself the next day. I have had the opportunity to re-examine the fragility of my own life, and to recognize that I am extremely fortunate to have my day-to-day life and to be here at all, and that it's because of access to healthcare that I have that. So it's definitely not fun, but I would encourage young people who don't think of healthcare as a major issue to consider how fragile their lives can be, and how fortunate they are to have their health, physical and mental.